I am Dr. Christopher Heck. I am the medical director of the Augusta Health Hospice of the Shenandoah. Hospice care is a comprehensive approach to a patient's care, concentrating on the end of life, typically the last 6 months of life. We are here to support the patient as they go through their declining process with the focus on relieving suffering. In order to qualify for hospice care, the patient's burden of disease is such that typically we anticipate death will occur within 6 months. That is a line in the sand that has been drawn by Medicare, but it is flexible. Predicting the dying process is difficult, and many people live longer than that 6 months, and additional benefit periods can be approved as time goes by. People feel and worry that hospice is present only to help people die. That is not our purpose. Our purpose is to be with the patient and their families through the dying process, but we are not interested in helping you die. We're interested in helping relieve your suffering for whatever time is left to you. Anyone can express an interest in hospice care. The patient's family can reach out to us regarding hospice care. The actual order for initiating hospice care from an insurance standpoint comes from the patient's provider or specialist, whoever is appropriate for them. In our area, there are multiple hospice agencies available to patients. We ensure that patients have choice in choosing whichever hospice agency works best for them, believing that our own hospice agency might be their best choice. So Hospice of the Shenandoah is an organization that is owned by Augusta Health. It was started many years ago by an all-volunteer organization and eventually became part of Augusta Health. So it is wholly owned, and we are a Medicare and Medicaid approved hospice agency. In addition, we are the only 5-star hospice in the area as rated by Medicare, and we work very hard to maintain that rating. The Augusta Health team is one of the best teams around. We serve our patients with great dedication. We are at the advantage of having an inpatient facility available, which many hospices do not. And it is available not only for end-of-life care, but for respite stays, which can last 5 days, to give patients' families a break from care. The Shenandoah House is a single-story building that is on the edge of the campus, nestled in the woods, beautifully landscaped. It's a home-like environment. We have 4 beds available, 4 separate private rooms, each one opening onto a patio with its own garden area. We have 2 nurses, full-time, 24/7, 365 days a year, that serve our patients. My job right now is my dream profession at this point. I get to spend as much time as necessary with a patient for the first time in my career. I can spend hours with one patient and their family to handle the problem at hand. In addition, my job is made much easier by the support group of professionals I work with. It includes nurse practitioners, physician assistants, nurses, social workers, nursing aides, chaplains, and a bereavement coordinator. We are not about helping you die, we're about helping you live for as long as the Lord wishes, with as little suffering as possible.